Hey, in the previous video, we have started talking about thalassemia. Now, let's get into it. And let's talk about alpha thalassemia. Alpha thal is the topic of today's video. Again, symptoms of anemia: tired and pale, pale and tired. Sometimes I have murmur, sometimes I have angina. Also, fatigue, exercise intolerance, etc. As you know from the previous video, thalassemia is a problem in the globin chain. Whether it's alpha or beta, it's kind of similar. So, normal adult hemoglobin has 2 alpha subunits and 2 beta subunits. They are called hemoglobin tetramers. Okay, 2 alpha and 2 beta. That's fine. So, thalassemia defecting globin chains. That's thalassemia in general, alpha thal or beta thal. So, 2 things will happen. Number 1, decreased globin synthesis will lead to decreased hemoglobin, because hemoglobin consists of heme and globin. Decreased hemoglobin synthesis will lead to decreased number of RBCs, i.e. anemia, because anemia has low RBC count, low hemoglobin, and hematocrit. That's number 1. Number 2, when we have a problem in the globin chain synthesis, hemotetramers will form. Certain products, will form, and they are insoluble, so they precipitate in the RBCs. Fine. What will happen? The spleen will recognize these abnormal RBCs with the abnormal precipitate and will start destroying the RBCs, leading to RBC hemolysis. The bone marrow will try to respond by producing more RBCs. Unfortunately, I cannot synthesize globin, so I cannot synthesize hemoglobin. I'm not able to do my job. Ineffective erythropoiesis. Poor bone marrow. So, thalassemia, be it alpha or beta, 2 things will happen. Number 1, I have anemia. What type of anemia? Microcytic anemia. And also, problem in the globin chain synthesis will lead to hemolysis and ineffective erythropoiesis. Let's dig deeper. Alpha thalassemia is a problem with the alpha chain or the alpha subunit. Chromosome 16 has 2 copies of the alpha gene at 2 different loci. So 2 times 2 equals 4 alpha gene. We have 4 genes responsible for producing of the alpha chain or the alpha subunit. So if I delete one of these genes, I'll have a problem. If I delete more, I'll have more problems. If I delete even more, I'll have more problems. So the more deleted, the worse the symptoms. Keep that in mind. So if only one locus is deleted, it's called alpha thalassemia trait. And it will have, one of them will be alpha alpha, the other will be alpha negative. So since we have 4 genes, so it will be like this. 2 of them are normal, and these others, one has alpha and one is negative. What are the symptoms? This patient or this kid is completely asymptomatic. What about if 2 loci are deleted? We call this alpha thalassemia minor. It can be either alpha negative, or alpha alpha, negative negative. What are the symptoms? Asymptomatic, maybe have very mild microcytic anemia, and of course microcytic anemia has low MCV. Now 3 loci deleted. So 3 of the alpha are deleted. So beta chains will now be unpaired. They form beta 4 tetramers. We said when globin chains are deleted, hemotetramers are formed. In this case, beta 4 tetramers. They are present in the RBCs but not in the bone marrow. These hemoglobin H or beta 4 tetramers. What are the symptoms? Moderate to severe hemolytic anemia. So there are symptoms. Number 4, which is the worst of the worst. It's called hemoglobin parts. What's hemoglobin parts? Okay, all of the alphas are deleted, so gammas, okay, form tetramers. They're called hemoglobin parts, and of course there is no effective erythropoiesis. Why? This gamma 4 has very high affinity to oxygen, so I cannot deliver oxygen to tissue since it's bound to the gamma. Okay, that's fine. What are the symptoms? Hydrops fetalis. Death in utero. The baby dies in the uterus. So, hemoglobin electrophoresis tells me the percentage of each type of hemoglobin. So, normally we have 97% of hemoglobin A, 2% of hemoglobin A2, 1% of hemoglobin F. However, in alpha thalassemia trait, I'm talking about the trait, okay, 97% hemoglobin A, 2% hemoglobin A2, 1% hemoglobin F. So in alpha thalassemia trait, hemoglobin electrophoresis is completely normal. However, if 3 genes are deleted, it's called hemoglobin H disease. So in hemoglobin H disease, what will be the hemoglobin electrophoresis? It will detect hemoglobin H. If 4 genes are deleted and it's called hemoglobin parts, what will be discovered on electrophoresis? The hemoglobin parts. So, alpha thalassemia trait, hemoglobin electrophoresis is normal. Hemoglobin H disease will get hemoglobin H. Hemoglobin parts will get hemoglobin parts. So what's the most common or most accurate test to diagnose alpha thalassemia trait or alpha thalassemia in general? It's genetic studies. That's the most accurate. So alpha thalassemia is present in African, Mediterranean, and Southeast Asian population. How to manage alpha thalassemia? If only one locus is deleted, it's asymptomatic, do nothing. 2 loci, asymptomatic, mild anemia, decreased MCV, like you have to observe them. 3 genes deleted, moderately severe hemolytic anemia, we have to get blood transfusion. Have to give them blood. Okay, we try to postpone it until they become adults. Hydrops fetalis, there is nothing you can do to cure it. Unfortunately, no cure. That's it for alpha thalassemia, and I'll see you next video.